Welcome to Ageless and Outrageous, your favorite podcast about how to age amazingly. I'm urogynecologist and hormone and sexual health expert, Dr. Kristen Jackson. Every week, I share my over 25 years' experience to guide both men and women as they age. Listen as I discuss a variety of topics, including hormone optimization, pelvic floor health, maintaining a vibrant sex life, weight gain issues, and skin, hair, and body changes as we age. It's happening to all of us, so listen for some solid scientific knowledge on how to handle these changes. Tune in for a dose of laughter, knowledge, and an honest perspective on the incredible adventure of growing older. The dry vagina is one of the most common complaints we see in women, pretty much starting with the menopausal transition, but we even hear this complaint sometimes for women in their 20s and 30s. Now, I've spoken a lot on this topic, but it deserves a lot of time. For women in their late 40s and beyond, GSM is a major cause. GSM is genito-urinary syndrome of menopause, and it describes the changes to the vagina and bladder that occur in women as we begin to lose our estrogen levels. So first, I'm going to spend some time today talking about GSM. But although upwards of 80% of women are going to improve with the treatment of vaginal estrogen, there are many other causes of the dry vagina that I want to go over today too. So you may have heard in many of my other podcasts on this topic, but GSM is the new term that replaces vulvovaginal atrophy. As women go through the menopausal transition, and then as they continue to live in menopause for the remainder of their lives, there are definite changes that happen to the vagina and the lower urinary tract as estrogen levels decline. But estrogen levels declining affects a woman's body from head to toe. But very often the vagina and bladder suffer the most since they require a much higher level of estrogen than other parts of the body. Estrogen is a vasodilator, meaning it opens up blood vessels. As estrogen levels decline, the blood flow to the vagina decreases. The lining of the vagina becomes thinner and more prone to micro tears when it's stretched, like during sex. Natural vaginal lubrication is directly related to blood flow in the vagina, so as blood flow decreases, the vagina becomes drier and tighter. Some women just experience vaginal dryness during intercourse, while others actually feel a dry, sandpapery, or even ground glass feeling inside the vagina at all times. That ground glass description is so apt, but I just cringe at the thought of it because rubbing any part of your body over ground glass just is horrifying. I've also heard it described as little knives or paper cuts in the vagina. There's no reassuring description of this. So it's no surprise that vaginal estrogen in the form of creams, vaginal pills, or rings tends to be our first-line treatment for GSM. And I really want to talk about the safety of vaginal estrogen. While, of course, each patient should make their own decision about their body, I want to make sure that you are making your decision not based on fear and not based on misinformation. Vaginal estrogen is exceedingly safe in almost every single woman. The package insert for vaginal estrogen would lead you to believe otherwise because it lists risks of heart disease, breast cancer, dementia, stroke. But none of these have been shown to be true. So how can that be? How can the package insert list things that aren't true? The FDA has a requirement that any product that has the same ingredient has to have the same warnings, even if those risks have never been demonstrated. So all of the risks listed that about stroke and heart attack are associated with oral estrogen, and they've never been associated with vaginal estrogen. In fact, multiple studies have actually demonstrated no increased risk of blood clots or cancer risk with any vaginal estrogen products. So let's think about what is biologically plausible. In order to increase blood clots and stroke risk, the estrogen would need to pass through the liver, where it increases clotting factors. Only oral estrogen passes through the liver. Vaginal estrogen, that's estrogen creams, patches, pills, vaginal pills, and pellets that go under the skin, do not pass through the liver. And let's look at absorption from vaginal products. There's only a minuscule amount of what is called systemic or whole body estrogen absorbed by a vaginal product. One study showed that using vaginal estrogen for a whole year, you would end up absorbing the same amount into your bloodstream as if you took a sum total of one birth control tablet. That's it, just one tablet. Another study showed that blood levels of estradiol are the same in women using vaginal estrogen as not using vaginal estrogen. So that would mean using vaginal estrogen, we can't even pick it up in your bloodstream. Vaginal estrogen is safe for almost every single woman, as I have said before, even those with a history of blood clots or breast cancer or stroke. And ACOG, the American Congress of Obstetrics and Gynecology, has released a consensus opinion, and I'll link it in the podcast description, stating that vaginal estrogen is safe in breast cancer survivors. So that statement was a huge push for the safety of vaginal estrogen in a lot of patients. It was finally a national organization really just restating what studies have shown for so long. And that's why I am so reassured by the safety data on vaginal estrogen, especially in patients with breast cancer. There's even one study showing that vaginal estrogen users have a lower breast cancer recurrence rate as compared to non-users. But of course, I'm not going to suggest that we use vaginal estrogen cream to prevent breast cancer recurrence. But it does bring a lot of reassurance that vaginal estrogen is placed locally, meaning right where we put it in the vagina and bladder tissues, and it is not circulating systemically throughout the entire body. Now, if you understand that correctly, it's going to treat vaginal and bladder symptoms, but that also means vaginal estrogen will not treat systemic symptoms like hot flashes or night sweats or irritability. If you are aware of all this safety information and you still want to make the choice not to use a vaginal estrogen product despite the data, there are some non-estrogen options that you have. These include vaginal DHEA, vaginal moisturizers, and vaginal resurfacing lasers as non-estrogen options to treat GSM. And they all do work really well. But usually, if I can have my preference, I would like a patient to start with a base of vaginal estrogen, build the tissue up as best they can, and then if they still have ongoing symptoms, then layer in some additional treatments like vaginal DHEA or vaginal lasers to really improve the situation. Now, there are other causes of vaginal dryness, even though GSM is a big one. Or, of course, you can have more than one thing going on. So you can have GSM and another cause for your vaginal dryness. So, one of the first reasons I'll look at that causes vaginal dryness that is not GSM are the medications that you take. Medications like decongestants that dry up your sinuses also, not surprisingly, dry up your vagina. Meds for your heart, like calcium channel blockers or beta blockers, can also have a side effect of some vaginal dryness. Benzodiazepines and even sometimes low-dose birth control pills can have that same effect of vaginal dryness. And of course, the big medication offenders are anti-estrogen meds like tamoxifen, Lupron, and anastrozole. These meds are intended to block molecules of estrogen in your body, so of course they cause vaginal dryness by blocking all the estrogen in the bladder and vagina. So it's important for your provider to review your med list and make sure that there's no med changes that can be made if you happen to be suffering from one of the side effects of vaginal dryness on these pills. The next cause of vaginal dryness can be certain medical conditions. A big one is diabetes. Diabetes causes damage to the very tiny vessels in our body called capillaries. And this is what leads to a lot of the end organ disease from diabetes. So if the capillaries in your eyes become damaged, you get retinopathy. If the capillaries in your kidneys become damaged, you get nephropathy or end-stage kidney disease. And it's the same in any organ. So diabetes that results in damage to the capillaries in your vagina can lead to vaginal dryness. It can also lead to difficulty with orgasm, which is another big topic I like to talk about because in both men and women, orgasm is related to good blood flow to the genital region. So anything that's going to disrupt blood flow is going to interfere with the function of the vaginal moisturization as well as orgasm. And we know that estrogen is a vasodilator, meaning it opens up those tiny little capillaries. So without estrogen and with damage to the capillaries, those capillaries are just shut up nice and tight, and the vagina doesn't get any blood flow and therefore no lubrication. But it's not just diabetes. There are autoimmune disorders that can lead to vaginal dryness. Autoimmune disorders result from an overactive immune system, causing it to attack your normal body cells. Diseases like Sjogren's syndrome can cause dry eye and dry mouth, but also I see it leading to dry vagina. Rheumatoid arthritis is an autoimmune form of arthritis that can also lead to vaginal dryness. And patients with MS, multiple sclerosis, also report a high percentage of vaginal dryness, even if they're younger and before menopause. So, managing these immune disorders, these autoimmune disorders, often involves suppressing the overactive immune system, which can help to decrease the attack on the vaginal cells. But those patients may still need additional treatments at the level of the vagina for complete relief. There's a category of drugs called anticholinergics, and people prescribe these to treat overactive bladder, which is what they're indicated for. But we know a lot of the older versions of anticholinergics have drying side effects: dry eyes, dry mouth, constipation. And sometimes these older anticholinergics are actually given intentionally for the drying side effects. Like for people who sweat too much, they might be given a drug called oxybutynin, not because they need to treat their bladder, but because they want the side effect of drying up their sweat glands. I'll tell you, these older anticholinergics are really not my favorite drugs to use at all, not only because the drying side effects are more annoying than anything else, but longer term use with these drugs has also been associated with a risk of dementia, whereas the newer anticholinergics are much less drying and are not associated with dementia, so they're much safer. And then anything that might cause painful sex is, as a side effect, going to lead to a dry vagina. So if you're having pain with sex, that can be a complex problem. It can come from many different sources. So you definitely want to see a qualified provider who can perform a thorough exam and get to the causes of your pain. But having painful sex for any reason may secondarily lead to vaginal dryness. And think about it, it's your body's natural protection mechanism. If we know that sex is going to hurt, then the vaginal muscles will reflexively tighten in order to protect us from that pain. That muscle tightening, however, is going to cause vasoconstriction. It's like the muscles are clamping down around the blood vessels. And as I've said before, less blood flow to the vagina means less lubrication of the vagina, means dry vagina. So if you're having pain with sex and vaginal dryness, it's really important to treat both symptoms. And sometimes it doesn't have to be actual pain, it might be fear or anxiety. It's fear for any reason during sex. If you're fearful that you're not going to perform well, if you're fearful that the kids are going to hear you, if you're fearful because during sex you're thinking, oh, I didn't do the laundry, or I'm going through tomorrow's to do list in my mind, all of that is going to cause vasoconstriction and maybe some muscle contraction, which is going to decrease blood flow to the vagina and dry it up as well. And of course, there can be fear during intercourse due to a history of trauma or a history of sexual assault. That definitely should be addressed with a qualified physician and a therapist. But anything that triggers a fear response is going to create that same muscle contraction. If you've previously had pain during intercourse, sometimes you know it's going to hurt the next time around, and that worry about the pain causes the vagina to tighten up. So that's actually making the whole situation worse. Anytime I examine someone with tight vaginal muscles, I always have to approach the topic of any history of sexual trauma. And because that's so painful, a lot of patients do not bring it up, especially at the very first time I'm meeting them. So I think it's really helpful to continue to approach that as we go through the workup and continue to ask them again at a later time when maybe she feels more comfortable talking to me or she's more ready to open up about a trauma in her past, because it may not be something that just comes right out in the first examination of a patient. And unfortunately, sexual trauma is much more common than a lot of people realize or think about. And for many patients, they may not even realize that there are relationships that do not have trauma in them. Many women, unfortunately, find that some form of trauma is a part of all of their relationships. So if they actually then find themselves in a healthy relationship, that history of trauma is putting up this barrier to comfortable intercourse, pain-free intercourse, and lubricated intercourse in their next relationship. So treating vaginal dryness with vaginal estrogen and lubrication alone is never going to solve the problem of pain during intercourse. We always need to get to the source of pain first. And sometimes, as I said, that just involves a lot of different providers. It might be a pelvic floor specialist to help release the tension in the muscles. It might be a counselor to help you work through any trauma or sexual issues. And it might be a sexual health specialist to get you feeling more lubricated and comfortable. And speaking of vaginal lubricants, let's make sure that if you are using a vaginal lube, that itself is not the culprit of your vaginal dryness. You can go back and listen to my slippery episode where I go through all the different types of lubricants and their pros and cons. But remember, the wrong type of lubricant can actually worsen dryness and irritation. I've talked about osmolality, which is the measure of how many dissolved solids there are in a fluid. And just for reference, water has an osmolality of 0. It has no dissolved solids. And the vagina also has a relatively low osmolality. It's around 300. So if you're going to use a lubricant with ingredients that have a high osmolality, they're going to dry out the vagina. So if you put a product in the vagina that has an osmolality of 1,000, water is going to leave the vagina in order to try to dilute the osmolality of your lube. So probably the biggest offender ingredients for osmolality problems are glycerin and polypropylene glycol. If you use those repeatedly, they can dry out the vagina over time. So I think your best bet is to use a silicone lubricant, which automatically has a low osmolality. It's amazingly slippery, and it doesn't cause allergic reactions. My favorite product is called Uberlube. We sell that in our office. It works fabulously. It feels amazing on your skin, but any pure silicone lubricant is a great choice. So there is never going to be a shortage of women going through symptoms of a dry vagina, but it is not something you need to live with. You want to talk to your provider. You want to make sure that they are looking at all of these different causes and offering you the many safe and effective treatments that we have to improve the dry vagina.
Thanks so much for listening to today's episode. No information from this recording is intended as a diagnosis or treatment for any disease. If you are enjoying the show, please subscribe so you don't miss any of our exciting episodes. And we love to hear from our listeners and would be grateful for your positive review. We'll talk next time.